lot of people in last 14 years we have served, and we feel proud to associate it with government of Mizoram and the people who have come down to Kolkata for treatment. Today we have with us three of our consultants who have been doing very good services to a lot of people. Dr. Harsh Jain doesn't need any introduction. He has been coming in Mizoram from last 14 years, and he has treated more than 2,000 patients of neurosurgery from Mizoram. So we have with him, and we also have today Dr. Nirmalo Rai, who is our neuroradiologist, who will brief about what new services that Medica brings in, what new technology that we do in Medica right now. And we have our with us Dr. Niket Arora, who is our cardiac surgeon. He has also treated a lot of patients from Mizoram. So we have a wonderful team we have, and it's a proud moment for us to introduce them. And now I will tell Dr. Harsh Jain to tell something about it. Thank you.
Thank you. Hello, good afternoon to everyone. Thank you very much for the introduction, and thank you all for coming today. As mentioned by Shubroto and Onrut, I've been coming here for quite some time. So 14 years with Medica and a few more before that with Apollo and AMR Aizawl. So I must say it is a pleasure. I actually tell a lot of my colleagues it is a pleasure and privilege to treat patients and families from Mizoram. Somehow, we've gotten along very well right from the beginning, and I would honestly say this from the bottom of my heart that dealing with people and patients from this region, it makes our job very, very simple because neurosurgery, as you can imagine, brain surgery, spine surgery, is a fairly complex and high risk game. And in this situation, it is very, very important to have the patient's confidence in the doctor. And probably this is the only place where, if I'm going to the operating room and I meet the family before going in, they would say, "All the best, good luck, God bless you, doctor." So that is a wonderful sort of feeling one gets, that that feeling of respect, that feeling of uh, honesty, courage, and also complete, should we say, reliance on the doctor's decisions, that makes our job a lot more easier. So that is one brief personal insight I would like to give as a specialist. Apart from that, yes, as mentioned, I have been coming here now for so many years. I've treated a host of, I would say, rather critical brain and spine surgery patients. And again, very, very fortunately, they have, most of them or all of them have done extremely well. And I'm very, very proud to show them in many of my workshops and conferences. And hopefully, this afternoon and this evening, I will be able to show you. Regarding the work, very briefly, in the neurosurgery department, what we do. So we have what is called the MIND team, that is the Medica Institute of Neurological Disorders. It consists of three consultant neurosurgeons. We are proud to have three DNB candidates, or what is called now DRNB candidates, trainees. And again, we have already had three of our candidates pass out, gone to their individual states. In fact, two are from Assam and doing extremely well as independent neurosurgeons, of which we are very, very proud of our training. Uh, we have three full-time neurologists, neuroradiologists I will be speaking to you about very briefly before that, and a whole team of dedicated neuro ICU, neuro OT, etc. So neurosurgery is a very, sometimes people say that why don't you go to other hospitals and operate? This is something I always say, that neurosurgery, cardiac surgery, these are very, very tech dependent and infrastructure dependent specialties. So it is not one thing to just go and operate and then leave, because things can happen, things change very quickly in neurosurgery and cardiac surgery, and one has to be there to support the patient and their families. So it is a consultant led department. We have a 24-hour emergency, consultant led emergency. So three consultants, we are on call on a weekly basis, and we are available 24 hours. Any emergencies, head injuries, strokes, hemorrhages, we operate as required in the middle of the night. So that is one thing. in terms of technology, infrastructure, literally we have it all, from the best state of the art microscopes, drills, modular OT tables, neuro navigation, where it's kind of a GPS that we use to enter inside someone's brain. So we have all that neuro monitoring, very, very good hand picked OT staff, which have been specially trained by us. They've been with us right from the beginning. So, all these things actually make a difference to the outcome. As a surgeon, one might spend about 3, 4, 5 hours operating, but it is the aftercare in the neurocritical care unit, in the wards, by the nurses, that actually brings out a good outcome. So, that's generally about what we do. And of course, if we go down to specifics, I don't want to be very technical, but we deal with all sorts of, say, brain hemorrhages. You have all heard of strokes. I'm sure you all would know someone in the family, friend circle who have had a stroke and has been referred to a hospital. So we deal with all kinds of strokes, both from the medicine side and from the surgery side, and also from the interventional neuroradiology side. We deal with all forms of brain tumors, right from the very child. I mean, in fact, one of my patients is currently actually undergoing radiation and chemotherapy in Kolkata, so he could not be here today. They've sent a message, maybe I'll be able to play that. So, right from 1 day old children, we operate with congenital malformations, brain fluid problems, brain tumors, right to the elderly age group, 80s, 84, where we have operated for brain hemorrhages, spinal conditions, etc. So basically, in short, we under one roof offer the whole gamut of neurology, neurosurgery services with the best possible infrastructure, instrumentation, skills, manpower needed to bring good outcomes. Uh, what else I would say? Yes, I think that's basically a summary of the kind of work that we do. And I would really encourage you to ask us some questions, anything that you might have, or any experiences that you might have amongst friends and family, please share with us. Before I finish, I would like to introduce Dr. Nirmalo Roy. He is a interventional neuroradiologist. Now, it is a long term. I find it difficult to pronounce properly the entire time. But this is really the new breed in neurology neurosurgery. So, with the help of catheters and wires, Dr. Nirmalo and people of his like, they are absolutely doing wonders, to the point that we are having to operate on less and less of very critical brain hemorrhage, principally brain blood vessel related problems. We are having to operate less and less because we have people like Dr. Roy who can actually do wonders with a catheter. There is no open surgery required, anything through the groin or from the radial artery. They can access the deepest corners of the brain blood vessels and deploy various instruments and implants so that the patient can be healed. So, this whole avenue has now been open to us, and we are very, very fortunate to have him with us. He's our newest entrant into the Mind team, and we are extremely proud. He has already done some very, very complex cases. And the good thing is that now people do not have to go outside our state to get these kind of services. So previously these were available in Delhi, in the south, Madras, but now all this is available at our doorstep and complemented by our new oncology building. So we again have the state of the art radiation, chemotherapy, consultants, everything in house. So again, like in the past, if I would operate on a brain tumor, after that for any malignant brain tumor, we would have had to refer to another oncosurgery center. They can now be directly referred into one house. So that brings the whole, complete picture. So as I mentioned, this child is having radiation and chemotherapy in our center. So that's about Dr. Nirmal Roy. And regarding Dr. Niket Arora, again, we have only met. He's also fairly recent entrant into Medica, but he's doing wonderful work in the field of cardiothoracic surgery. He will elaborate, but whatever little I've heard is something called fast track, where even the most complex cardiac conditions are dealt with and patients are discharged in a much, much smaller period of time than is what is considered conventional. So, with these few words, I will then pass on my mic to Dr. Roy. He will say a few words about his specialty, a bit more detail, and then Dr. Niket Arora will also speak with you. And in the meanwhile, if you have any questions, please feel free. This is informal. You can ask us anything. Thank you very much. Hello.
Hello, hello. A very good afternoon to all of you. This is my first time to Aizawl and Mizoram. So I joined my team in the month of March this year, and I have been started treating patients as sir has already said. So in my specialty, the uniqueness is we can treat various problems in the brain, which is related to the blood vessels of the brain, without needing to cut the skull or opening the skull. We can enter the vessels from the through a very small pinhole in the groin region or in the wrist, and we can reach the very distal vessels in the brain. We can travel very far and we can reach those vessels. And if there is some disease like some balloon that has formed in the brain, which is called aneurysm, we can treat that with various methods. Or if there is any block in the brain vessel, like there is some clot that is occluding one brain vessel and patient is suffering from stroke, with these catheters we can remove the clots also from the brain. The biggest advantage of these procedures are that we don't need to cut the skull, and it is a very minimally invasive procedure, so patient can be discharged at a very short period of time. I have been fortunate in treating my patients from Mizoram in my previous hospital as well as in the present hospital. As Sarah has already said, it's been a wonderful experience in treating patients from Mizoram, because very rarely we get to encounter such well-behaved and well-mannered patients who are ready to take the risk and who are ready to listen to the doctors and doctors' opinion. So, thank you once again, and that's a brief about this field. This is a relatively new field. Probably Medica in Kolkata is one of the few hospitals in the entire eastern region which is providing a 24/7 into 365 coverage for both the open and the minimally invasive neurosurgery in this region. So we can cover any patients whenever required uh, for treating various neurovascular diseases as well as neurosurgical diseases, as Sarah has enumerated in his talk. Thank you.
Thank you, Dr. Niket.
Hello, it's
Mic is-
speak on that.
Come.
Hello. Hello. Am I audible?
Yes.
I'm Dr. Niket Arora, consultant cardiac surgeon at Medica, and I mainly do bypass surgery on the beating heart, and like to communicate well with my patients. One of my patients is sitting right behind. He's come. I've been fortunate enough that he's come here to see me, and I specialize in beating heart bypass surgery, and I like to mobilize the patients early. And Medica is quite supportive in giving the best quality post-operative care, in mobilizing the patients early, bringing them out of ventilator after the surgery, whether it is the heart valve or bypass surgery. And one of my USPs are fast tracking. I like to keep patients less in the hospital and send them away early. I give them full access with the WhatsApp number, so that if they have any post-operative complaint, they can tell me. And I have some few observations about the patients from here. One of it is all of them are very, very well behaved, number one. Number two, they have extreme good tolerance to pain. If they have pain, they are not going to tell me very early. So if the patient is complaining, that means there is something very, very serious. So we look into it very, very critically. Number three, what I have observed is they have high tendency to bleed, because maybe the platelet or blood structure is like that. So we are very careful before operating that we stop all the blood thinners. And number four, all of them dress up very coolly. That's it. Thank you.
Hello. Hello.
It's not working.
Hello. Today we are very fortunate to have Dr. Jain and Dr. Nikhil Trishik here to give their testimony. So I would request Dr. Jain to be on the dais and rest of the doctor, and I would request our general manager and you can please sit down. Please, please. Please, please. The idea is to the idea is to understand what was the case, and because we understand always talking in English may not be make you understand what exactly the case. So the patient experience is very important. Patient experience is very important. So first I will request Dr. Jain to elaborate the case, and after that he can give the mic to patient relative the way they have got treated at Medica.
Honestly, the first thing that crosses my mind is I'm having trying to look which side of the brain I have operated. And I think if you are sitting there, it will be difficult for you to tell that which side of the brain has been operated. But I'm very grateful for you and the family to come here today. I think we found out later on that you are related, right? So again, we would request you to say a few words. But basically, both the gentlemen here had come with a history of a seizure disorder. You know, epilepsy, seizure, shaking. So one of them had a sudden one-off episode of dizziness and blackout, and the other person is having about 18 years of seizures, regular seizures. So on the MRI scan, both of them had something called it's a blood vascular lesion. It's like literally having a popcorn inside the brain. It looks like a popcorn in the MRI scan, and it is basically a blood vessel filled. It's like a knot of blood vessels, which is then irritating that part of the brain and causing fits. So, and the other problem with this kind of lesion is that it can bleed time to time, and that can cause further problem like paralysis, etc. So, after discussion, MRI scan, so we operated on both of them very, very recently, and this is where I was mentioning it's very important to have the GPS because the skull is there and we are seeing on the MRI scan, but to tell the surgeon exactly where to open, that is quite critical. So just like we use nowadays GPS freely, we cannot move without GPS. Even if we roughly know where we are going, we still use it for the last mile. So the same thing in surgery during our operations, we have a very expensive piece of equipment which then correlates the patient and the MRI scan and tells the surgeon exactly where to do the cut. So then we can do what is called minimally invasive. So rather than opening a large part of the brain, we can actually just zero in to the exact point, open only small part of the skull, small part of the brain, and we can take any tumor or lesion out. So that was what was done, and fortunately both of them did extremely well. And I would now request the family members and the patients to say a few words about their experience in Medica, good or bad. You don't have to be complimentary here. Please tell us. And any changes that we need to make, any communication, anything, please feel free to talk. No, it's on and off.
Saya itu kan itu dah kan pan itu. Lain dah le tu ni kan jadi kan hansiam tu kan. Kau nak tim kan kan lo le tu kan ini tu kan dia. Soalan ni. Ni orang siapa kau ke lo orang dah dia. Kalau ikat kata lo kan ni kan han buat tu soalan. Serta soalan ni apa kan tim tu ni lo kan. At mo mo dia kan dia sen kan cuma masih tu lebih yang tu kan orangก็บวยคุยทางซึ่งเราก็ยังก็เทียบเราตัวกินข้าวนี่มันชั่วที่แบบช่วยดูได้ส่วนที่ข้าวนี่มันบอกตั้งข้าวนี่โคตรพิจารณาปันคุยตาโคตรพิจารณามันหันเส้นข้าวพี่หันเส้นข้าวเราสร้างเแบบนี้มาเสียไอ้เงี้ยให้พี่พิสานสันที่กันเตะสันเดียส่วนนี้ซีทีสแกนเตะยังไงอย่างเดียวเนี่ยเราซีทีฮอสพิทอลมันกันมาสาดีส่วนAizawlฮอสพิทอลทงไม่รู้วันยังAizawlฮอสพิทอลกันชมตาส่วนAizawlฮอสพิทอลซีทีสแกนเด็กผู้ป่วยเด็กขันที่มาหลงพระบาส่วนตาขันนี่มีมาถึงงานแล้วนี่กว่าเช่นเราตาอยากพอขันเสียเราว่าอยากลงนุ๊กริมไปนี่เสียเราจู่ๆนี่ตาส่วนนี้นี่ตาอีนั่นหันบวยปุยเสละจานดามนี่เนี่ยจริงๆลำดามนี่เนี่ยอาจารย์เรียกข้านี่อามาฮีอารมณ์บ้างไงโซเบียมาเสชุดยางาให้นี่พวกเสียหันยาพวกการนี่ยังทันได้ตกโจนี่แล้วว่ามิชิงลำหันเกี่ยวตัวนี่อาเบยโดนชาก็อาทิไม่โดนมันจะกันตีอ่ะกันเบยอาตองงงมาเสให้ด็อกเตอร์เตะเราเป็นมีเตะเราเนี่ยน่าบางข้านี่อันนี้ข้านี่หันเอ็นเวล่ะส่วนตาข้านี่มินป่วยปุยอ่ะก็ปุยแต่เงี้ยให้หลอกลวงกันตีอ่ะไอ้มาที่ส่วนนี่ที่การAizawl hospital dan kan ina po hoto lo kanin doktor kanin ambulance nin subanga ina po swak in lo amahi athwa ka ati senzam hi achat manang ti kanau ati awangin emergency room rubin kan chok chata ambulance ni rekula ya ko kal ko ta ko ni se ambulance te ken ni lo ba ka engkim doktor moite ni lo kwai pui be ka chuwang chuan doktor moite chunga ko hen chemical tang han lom thu ka soya tin ba ka ashim chimin hei kan ba hi dam lo na yin ki se lo na yin ma cha buak ve awang yanin har san na tam tak kan to ka ma se he kan har san na hi ke ni machine la ma chuanin chin har kan dia ma se khulaya doktor te le nurse ten thi am tak le ni en kol thata kan lo en kol the awang yanin ni a thok tu te zong sam tu ma lom thu kan soya tin le har san na to thin ma ila anin do thei takin min do thina kan lon tak ne mewa chuanin khati kha ania chuanin hei boina hianin aro pui ka tia hetia anga hun kan han nei thei te hi chuanin ni beidong lovin omila hei ke te pe chu beidong tu mai ka anta ni lai hianin GI voi mai tur ka ni lai pathianin min dong puya pathian wang chu min GI lovin kom te ka pasan kha ka chan man ni ve hian ke en shani chu wal ka tiam ni lo se GI phili taila ka pasan kha i chu se har sanna na sa ta chuwa theng to na ni mishing te la ma chuan a bei dong kan bei dong ma se tu na hanin kan pa hi tu ni na dam tak ba ya lo theng na san po ama sa vera ton pathian ni a dong le chuan doktor te le nurse te i ध्यान नते डॉक्टर ध्यान नते गल पन बल का सोमा फागा नहीं देखा बस वही दुआनी है चू चू और से
It's fully miso for us is may not be able to understand how everything is positive. So I will request Dr. Jain take it forward, and later on we can call Dr. Niket Arora's patient. He is already arrived here.
Thank you for coming. I think Rev is okay. Rev, please come.